Hello and welcome to Paincast, Conversations on Pain and Physiotherapy. This podcast is brought to you by the Pain Science Division of the Canadian Physiotherapy Association. I'm Tiffany, the host of Paincast and an executive member of the Pain Science Division. I practice physiotherapy in Toronto. We have a pain crisis. Where were we and where are we in pain advocacy today? Does pain advocacy really work? Has anything changed in the past few years? Join me in my discussion with key physiotherapy leaders in Canadian pain advocacy and hear about how the advocacy started and how it has continued to evolve. Before we start, do you know we've recently launched an Instagram page for Paincast? If you liked our podcast but don't always get to catch up with the episodes, but would still love to learn from our amazing guests, this page is made for you. We create short videos to summarize a topic in 1 to 2 minutes. Let us break up your doom scrolling with some golden physiotherapy tips. Follow us at paincast.psd. Enough about us. Let's dive into this very important topic of pain advocacy. Hi everyone, this is really exciting for me. I have had wanting to do this episode on pain advocacy for a very long time, and I'm excited that we finally get to chat and we have an awesome crew here, perfect to talk about this topic. First of all, Krissy, Arthur, Nathan, how are you guys doing?
Doing well, thank you.
Good, excited to be here.
Yes, I'm also very excited to chat. I love getting to chat with physios, so I'm excited for this whole evening.
Amazing. All right, so we'll start with an introduction of all of you. Briefly introduce who you are, what you do, and what a typical week looks like for you. So we'll start with Krissy.
Sure. I'm Krissy Bell. I'm the Chief Executive Officer at the Canadian Physiotherapy Association. I've been in my role for coming up on 2 years, although that doesn't feel real to say out loud. It feels like it's been 3 minutes, but I have been at the CPA for several years, almost 6. And my day-to-day life changes every day. I spend most of my weeks working with different partners or members of the physiotherapy profession or members of the Physiotherapy Association to understand the needs of physiotherapists. I do play a big advocate role as the leader of the association, and I'm in a lot of meetings with government and other officials. But I also work on things like budgets and HR. So I'm very fortunate in my role that I get to touch all kinds of different pieces of work and understand and help drive the machine that is the Canadian Physiotherapy Association.
And Arthur.
My name is Arthur Vesnatsky-Vu. I'm a physiotherapist, been practicing for 11 years now. Just had to do the math real quick in my mind. And so I've been working in private practice, and after having worked in private practice for a few years, started a PhD at McGill under the supervision of Dr. Tim Weidman and Dr. Michael Sullivan, and really kind of focusing on the area of chronic pain and how we can better integrate physical activity as a treatment. So really come from a physiotherapy standpoint. And so I finished that PhD a little over a year ago and opened my solo practice, the Chronic Pain Rehab Clinic. So I work out of Montreal and try to really focus on physiotherapy that is helping people who are living with chronic pain, and not just chronic pain, but any pain. From a standpoint of where I was with respect to other areas of my professional life, I'm currently doing some part-time teaching at Concordia University on the pain management course. So I've been volunteering a whole bunch. I've been volunteering at the Canadian Physiotherapy Association and the Pain Science Division since 2015. And as the years rolled by, between 2021 and 2023, I was the chair of the Pain Science Division and also the lead of the working group on pain advocacy.
Yeah, when the pain advocacy rise in the political realm, you played a very important role in advocating on behalf of physiotherapists. So we'll definitely get more into that. All right, last but not least, Nathan.
My name is Nathan Ojar. I'm a physiotherapist as well. I come from Belgium originally, and I moved here to do a PhD at McGill in the same lab as Arthur. And my thesis is looking at improving how physio students learn to manage chronic pain across the country. So it's a really exciting project, and we're working with all the programs in the country to try to improve how physio students learn to manage pain. So that really made me so much more interested in chronic pain management and advocacy. And on the side, I started my own company called Physio Connection, where we really try to improve access to pain management in more remote regions, because we know that virtual care can really help people with chronic pain. And so often people living in remote regions don't have access to care. So my day-to-day life is really varied. I would say it's mostly behind a computer, but the tasks I do are quite different. It's mostly driven by PhD, whether I'm writing an article, a submission, collecting data, meeting stakeholders. And then when I have the time, I work on some of the other projects, including this working group on pain advocacy, which I've been a part of since its inception. And I've also been working with the pain science division.
Yeah, so Nathan has taken the baton from Arthur and now is leading the working group on pain advocacy. So, Krissy, could you briefly introduce the function of the CPA in terms of pain advocacy for those who aren't familiar?
Sure. The CPA as an association has a responsibility for advocating for the betterment of the profession or the betterment of the healthcare landscape and the positioning of physiotherapy within that landscape. So pain advocacy becomes one part of that, but a big part of my role is understanding what's in the current operating environment if you're a physiotherapist, what are the challenges, barriers, opportunities that are relevant in that system, and how can we as an association try to get ahead of or understand what the opportunities are? And also, how can we break down barriers that exist? I'm a CEO at a very interesting time in healthcare, and there's a lot of innovation happening slowly, but there is innovation happening, I think, really spurred on by the pandemic. And advocacy in this time and in this space has given us a really meaningful opportunity to influence decision makers and influence structures, procedures, processes that are either inhibiting or facilitating barriers to access for physiotherapy for patients. And so pain advocacy becomes a really important piece of the dialogue, especially while we're looking at things like the opioid crisis or other pieces. This advocacy becomes an opportunity for us to be very solution oriented with decision makers and elevate the role that physiotherapists can play in the healthcare system writ large. That's a very high level response. I think there's a lot of tentacles that we'll likely get into over the course of the discussion. But from a really practical standpoint, the CPA wants to facilitate and equip members like Arthur, like Nathan, who have the expertise to share with decision makers about why it's so important for physiotherapists to be a part of pain management and to ensure that the bureaucratic systems that influence healthcare and healthcare decision making are thinking about physiotherapy. I can remember when Arthur brought forward the idea of having a statement, a response around pain, and kind of started the initial inception of everything that has come and everything we'll talk about today. He's a pretty hard guy to deny. You can see the passion, and Nathan definitely lives that as well. But there's a really important part of our members. I can think of Janet Hawley or Dominique and lots of members in the community who went, this is really important for us to do this work. And the association wants to foster that passion in physiotherapy and give people a platform to share their expertise and share their evidence and their research. And this was a really great opportunity, both because it was timely for decision makers, but also because we had such a wonderful group of really passionate leaders who were operating in this space and knew it really well.
That's great. Arthur, maybe you can start with how you have the idea of creating the working group of pain advocacy and how is it serving in pain advocacy on behalf of physiotherapists?
Yeah, it's a fun story. And what I'll try to do is, as I'm saying it, try to kind of just add a few thoughts on the side that I have that will hopefully inspire and encourage a lot of others to also do something similar. The way that this started was not planned, not totally prepared, but more of a matter of seeing a wave and trying to catch it. When I became the chair of the pain science division, it was just a few months after something that was pretty historic in the Canadian healthcare landscape, especially in the area of pain, because the Canadian Pain Task Force produced its final report that included an action plan for pain in Canada with a thorough series of recommendations of what we could implement to make the healthcare system in Canada better for pain. Now, this has never been done before. And to have this kind of ecosystem where all of a sudden there's this willingness to really evolve the healthcare system and really kind of recognize the importance of pain and improving pain care just made me feel that, gee, I got to do something about this. I can't just let this float by. And so when all the division chairs got together at the CPA, and for those of you who are not quite familiar with it, the divisions are essentially like special interest groups. And when all the division chairs would kind of come together at the CPA to talk about, hey, what is it something that we can focus on as a joint initiative? I just kind of floated the idea by innocently because I thought it was important for me as chair of the pain science division to talk about this. And I was really thrown back by how it immediately attracted so much enthusiasm and interest from all sides, not just the division chairs, but also the staff from the CP that were there. And what I heard from other people is that there was an unprecedented synergy in terms of all parties, all the different components of the CPA, both volunteers and staff from different interest groups coming together in partnership with a singular advocacy goal. And so since the fall of 2021, over the course of 2 years, roughly, were a series of, well, first of all, kind of forming the working group between not just the division chairs, CPA staff, but also more broadly, anyone who wanted to hop on board as volunteers. So we first kind of formed the working group. We went through all sorts of consultation techniques using structured brainstorming techniques like modified nominal group technique. We used focus groups, we used surveys, and we really tried to bring everyone's voice into the thought process here. And the CPA staff was really instrumental in this as well, because we're not people who have expertise in marketing, communication, government relations, and so many things that is outside of physiotherapy. And when we think about what was really the most impactful end product, it's something that would not have been possible without the CPA. We were fortunate to have the support of the CPA, where it resulted in hiring an expert consultant writer who had expertise in producing position papers. And so that's what we ultimately did. We produced a position paper that tried to recognize what areas of the Canadian Pain Task Force Action Plan for Canada is relevant for physiotherapy, not just relevant, but from those rank them in terms of order of priority and speak to where physiotherapy can play an important role and articulate that in a document and disseminate that. And so the landing point for that was National Physiotherapy Month 2023. What I'm trying to convey with all of this is not just getting people familiar with how all of this happened and how it evolved, but also to let people know that I had basically no experience in advocacy before doing this. I certainly had no experience in lobbying. We'll talk about the lobbying efforts that we did. Certainly had no experience in trying to lead national campaign. Well, partnership was really key here, but so anyways, point is that you can kind of walk into the room and be like, hey, this thing, I feel like it makes sense to talk about it. And then people come and figure it out together.
That's a very inspiring experience and story. And to see how far the working group on advocacy was able to go in terms of being able to meet with senators, MPs, and really getting the word into the government of Canada that we serve an important role in pain management of Canadians. So that's great.
Can I add a few things, Tiffany?
Yeah.
I think there's two things that I would really call out that, from my perspective, I learned a lot in the process. I was not the CEO at the time. I was in a chief marketing role. So I was working with the group quite heavily, but I wasn't the leader of the association. And I think it's important to realize how long it took at the beginning. It wasn't about, hey, we have an idea and we need to get this in front of government immediately. It took years for us to really build what we were trying to say. And at the time, if you had asked me in 21 and 22, like, what's taking so long? I don't know that I would have known. I don't know that I would have known why it was taking us so long to figure out exactly what we were going to say and then get a writer. And it makes sense now when you talk about all of the steps. But One of the pieces I think is really important for volunteers to take away is some of these things are like an avalanche and they really need to pick up steam and they need to grow or kind of snowball, I guess, as they go. And I don't think if even in 21 and 22, when we first started to really identify that we were going to work on this initiative and we didn't know what it looked like, I don't think we would have been able to conceive of the size that it became or the impact we were able to have. And so I really want to lean into that comment that Arthur made, where it's say the thing, tell us the thing. Even if you're not the chair of the pain science division, the association wants to know what's on your mind because sometimes it doesn't take hold right away. Sometimes it doesn't feel like you're getting the traction that you are, but it's because the timing or the pieces that need to come together. The other thing that I think is really important, and that I don't know if I've ever told you, Arthur, and I think it's important that you know this, is this has really set the foundation for how the CPA tackles big issues with their volunteer leaders in specifically the advocacy space. In 21 and 22, we put our heads down and we did, as Arthur said, a lot of research. We pulled together research, we hired the right people to write the evidence. And if you were to ask me now what our advocacy approach is, it is evidence and data first, and then messaging that comes from that. And unknowingly, we were going through and testing that as a cycle that we were going through at that time. So in 21 and 22, we were getting buy-in, but we were also aligning on what are our core messages, what is the important pieces of evidence, what are the important pieces of data to understand what the science is behind why it's important. But that really equipped the staff to go, I have lobbied and I do know how to lobby and I can get in front of the government. I'm a salesperson. I can tell them what to believe, but it's got to come from something, some source of truth. That's a distinguishing factor from physio. And this exercise was a really great preliminary exercise before getting into something as giant as scope, which we've done since this project, to really say like the science and evidence come first. And the messaging and lobbying and advocacy are only as strong as the work you put in at the front end.
I want to bounce off that last bit that you were talking about there, Krissy. The way it started at the beginning was me literally saying, I think we should do something about this, but I don't know what. And so actually the first couple of meetings that we had as a working group on pain advocacy is we all agree that we should do something about this release from the Canadian Pain Task Force. Let's figure out what it is that we should do. So this whole comment that Krissy made about, you don't need to have this like perfectly developed, I was going to say business plan, but it's just to give you an image, you don't have like this perfectly developed idea or even to have any particular position or numbers of years of experience or anything like that, but just to say, hey, I noticed something, maybe we should do something about it. Because quite frankly, I mean, that's how it happened here.
Oh, I liked that we went down this little chat about how it came about and how the CPA came behind and supported the initiative. In the 2023 CPA Congress, I interviewed a number of leaders in CPA divisions and branches. And one of the questions I asked them, what do you like about taking on the leadership role for CPA or the branch? And many people, to my surprise, said, I love the people that I work with. So I can see a little bit here too. Like Arthur, you just came up with a thought that we should do something. And it's taken up seriously, then the process was worked out, and then one step at a time became sort of like a blueprint for how, as physiotherapists and the professional association, go about future advocacy. So that's very nice. Wonderful. Okay, why are you so passionate about pain advocacy? Why should we talk about it?
For me, pain advocacy is about bridging the gap between what we know should be done and what is actually being done. And so this is why I find it's really motivating is when you speak with people living with pain, they don't have access to the care they need. They don't have the high quality of care they need. And we know that there are things that work. So a way to help them is really by advocating, for example, physiotherapy being a really good non-pharmacological approach to pain management. If people don't know about it, how can they use it? So it's about saying, hey, there are options. And it's not just my personal opinion. It's based, as Krissy was saying, on a lot of research. We know this works, and this is a really great addition to other existing resources for people. But we need to put our hand out there and say, we're a really good option for this, and this is how we can help. So I think this is what really motivates me is let's bridge this gap. We know what we should do. We know what is not being done. Let's get the things together.
Absolutely. Krissy?
Yeah, I would add it's very timely. There's an opportunity for us, and I feel this way about so many things where I say, we have Arthur and Nathan who have tons of research and experience and expertise around pain. We can say that about a lot of things within physiotherapy. A part of why this initiative got legs was because it was also timely with what government decision makers were talking about. Because as much as I love the previous dialogue about picking up an idea and the association picking up an ideas, sometimes we don't pick up ideas. Sometimes that is just an issue of timing. And a big part of this was we knew we could have policy influence given the stature that the topic had by the striking of the task force by the federal government. So we knew that it was topical for them. In addition, the preliminary conversations around things like pharmacare, the opioid crisis had already begun at the federal level at that time. And so we could start to see a path to having a conversation with the government about physiotherapy that would allow us to influence policy that was already being developed. So it wasn't going in with a completely new ask, something that they weren't hearing about, having to educate people from the complete ground all the way up to influencing a policy decision. But it was about getting the right information in front of people who were about to make decisions about those things already and making sure that they were considering all of the different evidence, all of the different options available for treatment. I think a big part that gets lost in the pain conversation at my level, when we're talking specifically about policy influence in the government, is the automatic conversation or automatic brain space for somebody who is not well versed in healthcare is to pharmacological pain management. And so the government now and at the time, we were just fresh coming out of COVID, they're constantly being screamed at in advocacy meetings, and then often rightfully so, to say, like, the house is burning, somebody help us. This was an opportunity for us to go, the house is burning and we're here to help. Like, look at what we can do, how we can take pressure off of an existing system, reduce reliance on pharmacological pain management, reduce reliance on physician roles. There's a place that physiotherapy can play in an interdisciplinary framework if you rethink the way you're approaching pain management from a policy lens. So I think that was another part of it that was really important for us, was the policy influence piece really made pain topical and relevant for decision-making tables. And it allowed us to get meetings that we probably wouldn't have gotten otherwise. Hey, we know you're talking about this already. Well, there's some stuff you don't know that we can make your job easier if you take this meeting. And so some of that was a product of the right time, the conversation being relevant nationally and internationally, and the government kind of looking for solutions that were outside of what their traditional solutions had been, because the pandemic had really exposed a lot of flaws in the system.
So we've been talking about the task force quite a little bit. And for those in the audience who are not familiar with what the Canadian Pain Task Force is, it was established in 2019 under the Ministry of Health to establish a national approach to address chronic pain. In that time, from 2019 to 2021, where the 3 reports were produced, did physiotherapists or the CPA had a role to play in that, or is it more so afterwards?
I'll just pick up on this idea here of providing context. You just started here, Tiffany, and I'll back up even further in time to give an even broader context. Earlier in our conversation, I talked about how I saw it as there being a wave and that I need to catch this wave, which, as Krissy was saying, advocacy is something that tends to succeed when you're very opportunistic about it, when there is a very profound need for it. Unfortunately, at the level of the federal government and other governments, such a profound need usually arises from a crisis. And pretty much everyone is probably familiar with the opioid crisis, which now is referred to as the overdose crisis. And it's something that started in the late 90s, right? We think about it in terms of how it is in the somewhat recent news, but the early 90s and in early 2000s, there have been a really rapid increase in opioids being prescribed. And then in the 2010s, there was a rapid increase in toxic illegal drug supplies that started being part of the opioids. And so there was increasingly a large proportion of opioids that were illegal opioids. And so now we hear things about like fentanyl and being laced with other drugs. And in 2016 is when the government really started to officially record what is going on at that level and taking very concrete steps. Since 2016, there's been over 40,000 Canadians who have died from opioid toxicity. That's in the recent years, averaging out to 21 deaths per day. And so, rightfully so, although for many years, people working in the area of pain have talked about how the healthcare system needs to improve with respect to how it helps people living with pain. It took a crisis to really prompt the government to make some dramatic actions towards improving the situation. And so they struck the Canadian Pain Task Force that first produced an initial report in 2019 that had to say, what's going on? And so really looking at the research, really looking at what knowledge is available out there. And the second report was a consultation, because what you're able to read through research and what happens when you start talking to people sometimes is not the same thing. And they did a great job of doing that and use that integration of sources of information to then produce the recommendations, the action plan for pain in Canada in the spring of 2021. And in this Canadian Pain Task Force, a lot of the composition was, as one would expect, people who are medical doctors or academics in the area. But we did have a physiotherapist on it. So shout out to Mike Sangster for your very valuable contribution as a member of the Canadian Pain Task Force. But it's also important to recognize that the Canadian Pain Task Force is not just the people who were on the task force, but there were a lot of groups and people who were consulted frequently and on a regular basis. And so a lot of other physiotherapists and other healthcare professionals in the area of pain were involved in this. Now, the Canadian Task Force had a very specific mandate. It was to produce those reports. And in fact, their mandate initially was much narrower in scope than what they ended up producing, because as they started producing, it kind of like that snowball effect, and the government jumped on board and it grew into something much bigger than the initial mandate. But it still had certain boundaries, which was really just kind of see what's going on, make recommendations. And so as the Canadian Pain Task Force came to its conclusion, the next order of affairs was to implement these recommendations and to actually make change. So Health Canada created the chronic pain policy team to do all sorts of things to try to support the implementation of the Canadian Pain Task Force recommendations. And so that was a bit of a top-down approach in terms of getting the implementation supported, coordinated, facilitated. But there was also a bottom-up approach in terms of trying to implement the Canadian Task Force recommendations. And so a year after the final report, so spring 2022, Pain Canada was formed. Pain PC played a big role in it, but it really brought together all the pain-focused organizations across the country, because there were a lot of little pockets across the country, but there needed to be a platform, a national action network that brings them together. And so Pain Canada was formed. And a lot of what they're doing is really bringing everyone together in this mission of supporting and the implementation of the Canadian Task Force recommendation. And they've also done a lot in terms of producing resources for people in pain, professionals working in this area, as well as forming a national advisory committee and so forth. From our standpoint, along that path, we wanted to make sure that we were part of this change as key players, because different health professionals in the area of pain provide unique value in terms of their area of expertise. And physiotherapists are leaders and experts in non-pharmacological pain management and rehabilitation. And we provide that very valuable perspective alongside the pharmacological perspectives, the surgical invasive perspectives, alongside the psychological perspectives, so on and so forth.
But add to that, the action plan explicitly did not name professions because they didn't want to really take part in that and say, we designed these professionals to do X or Y. So we had those items for action, but no one really knew who was supposed to do what, in a sense. So this is kind of what stemmed our response to say, hey, as physiotherapists, with our unique expertise, we can lead this part. We can be collaborators on this one. We can inform that. So this was really the goal of this, was to respond to the different recommendations by framing it from the lens of physiotherapy and highlighting the areas where we can help and how we can help. I think that was really an important part.
You know, Krissy was talking about how a lot of people, when thinking about pain, their first thought, especially if you're outside of a healthcare profession, is to think about, well, what medication can I take for it? So there's this excessively unbalanced focus on pharmacological management of pain. And so when the opioid crisis, and more specifically the toxic illegal drug crisis, started to put the finger on this topic of, okay, we want to make sure that medication is prescribed appropriately, right? And so we just have to be really careful here, right? Because what sometimes happens is that we swing the pendulum too far. And so there were some initial reactions to the opioid crisis that led, unfortunately, to the stigmatization of the use of opioids. But what's important to recognize is that it's not about doing anything like that necessarily per se, but it's about recognizing when is it time for an appropriate prescription of opioids. But what we wanted to bring in with our expertise as experts in non-pharmacological pain management is to really make sure that we consider with equal footing right out of the gate what is most appropriate and what right balance of non-pharmacological and pharmacological management. There's a study that indicated that when physiotherapists were the first professionals consulted in the case of a musculoskeletal pain, as opposed to going straight to a doctor, there was between 50 and 89% decrease in opioid prescription. And it's not to say that it's about doing a 100% elimination of it, but it's just about recognizing that when there's cases of overprescription, it's about recognizing also, though, that there is a time and place maybe for this as well, and really kind of striking that balance. And so making sure that everyone is at the table with their expertise when talking about how to evolve the healthcare system with respect to pain care.
And from a policy lens, ensuring that the systems and barriers that exist to accessing physiotherapy as a pain management solution are reduced. Because there are policies and initiatives that exist that may create systems where other providers will write a prescription first, or writing a prescription takes less time, or it reduces the volume of time that you spend with said patient, not as a physiotherapist, but as another primary care provider. And so how do we embrace a team mentality and embrace interdisciplinary roles so that those structures that may reinforce the proclivity to go to prescription first are actually breaking down any barrier that the patient has to not seeing a physiotherapist about that pain issue, to Arthur's point, because I think it becomes a very theoretical exercise often to go, well, how do we create balance for other providers in understanding the utilization of physiotherapy versus other pharmacological methods? And this becomes a very important part of the policy discussion is you need to know that there's more than one option when you're creating the systems, processes, and the patient's journey through the healthcare system to ensure that physiotherapy as an option is considered at every step.
I think to add to that, the coincided with a shift from looking at pain as just a symptom to considering pain as a disease in itself. And I think that was really helpful to reframe how we thought about pain rather than just seeing it as something that comes with something else, and we're just going to give you medication while we figure out why you have pain. Recognizing that this is a disease in itself opens new doors for treatment and rehabilitation. So moving on from let's manage pain to let's rehab pain. So from pain management to pain rehabilitation, if we want to, and having this opportunity to look at more long-term treatment options for pain management rather than just looking at pain relief. I think that was also a big switch in the mentality that happened around this time and has been basically making it easier to consider pain as a key issue and easier to finding resources for that. So if we can say pain in itself is a problem, then it's taken more seriously in a sense, rather than it's just a symptom of something else.
Mm-hmm.
Yeah, this conversation is really making my brain fire in every direction. And I'm like, I don't want to talk about a million things right now. But earlier we were asking about what gets us excited about pain advocacy. And there are 2 points that I want to talk about, one to Krissy's point and one to Nathan's. First is that a lot of what we want to bring to the table in terms of conversation is the question of accessibility. And when trying to understand the overdose crisis of illicit opioids, and trying to understand what are some of the driving factors involved, something that has been identified is that there's a problem in terms of accessing adequate pain care. And when I mean adequate pain care, it's everything we just spoke about earlier in terms of kind of finding the balance between pharmacological versus non-pharmacological approaches to helping someone with pain. Just to unpack a few things, when talking about the opioid crisis, the reason why I'm bringing in these new ways of referring to it is because over 80% of opioid-related deaths come from illicit opioids and not from the prescription opioids. Although it may have started with a prescription opioid that could have created dependence, what then would follow through more often was overdoses from illicit sources of opioids. And it comes from a place of trying to just see like how can I help my pain, and if you don't have access to too much, well, I mean, you look for what you can. And if all of accessibility has been entirely shining the spotlight on pharmacological options, then that's kind of down the path that you'll keep looking. And so I think as we increase accessibility to non-pharmacological management like physiotherapy, it will also shift the conversation in terms of, well, what is important? Because if you only provide in an unbalanced way much more access to one type of treatment, it implies that this is the one thing that is the most important. But if you start providing equal access to other forms of treatment, then it tells you, hey, these other forms of treatment are also really important. And so this kind of stuff gets me excited about it in terms of pain advocacy. It's looking to the future and seeing how things could improve. Not to mention that when you look at all-cause disability, the number one cause of any type of disability, whether it's physical, mental health, or a disease or whatever, is pain. And so physiotherapists providing their perspectives from a rehabilitation standpoint is key. Physiotherapists providing their clinical care in the area of rehabilitation is key. But physiotherapists also, and this is where it's really interesting to think about physiotherapy, is that we are also really great educators when it comes to pain. And this brings me to maybe the last little point for now, because I realize I'm talking way too much. Nathan was talking about how it's so important that pain is being reconceptualized beyond just a symptom. Another way that I've heard it talked about is that when you talk about pain or when you hear about pain, oftentimes it's about painkillers rather than talking about pain as a normal part of life, as a protective part of our human system. And so we can talk about that more, but this whole idea of like, if all you think about is a painkiller when you talk about pain versus this is a normal part of life that can get out of control, but still it comes from a good place. It just kind of starts to reconceptualize how we understand pain and also how we care for it.
Let me bring the conversation a little bit back together. So how the Canadian Pain Task Force, when they formed, they provided the first report on summarizing what is pain management in Canada, how does it look like. They interviewed some people and produced a second report on lived experiences of chronic pain and a third report on that action plan. And Nathan mentioned that action plans explicitly didn't try to name professions in the overall recommendations. And the role where the working group on advocacy on pain and the position come in is to say, these are the things we can do in relationship to the recommendations. And what Arthur said was, it's really important for us to educate policymakers and even the public that physiotherapy and non-pharmacological approach is a legitimate approach on equal footing with the pharmacological approaches. Therefore, this needs to be considered so that physiotherapy accessibility can be improved. But let's dive a little bit into more details. Talk to high level about how physiotherapy can play a role in chronic pain management. What are the actual action items that we could be participating in or a co-lead of some of the recommendations? And talk a little bit about the position paper and how that served as an educating material for policymakers and the public.
Yeah, I think a high level overview, if you're just a listener, you don't know what to do based on this discussion, you get inspired, but you're not sure where to start. I think a big element is join the pain science division. I'm not a recruiter, but getting together with people who think the same and want to make things move forward is really, really powerful. So rather than just having your voice, you have the weight of the full CPA behind you when you are doing those initiatives. And as Arthur was mentioning earlier, you don't need to have all the answers. You can start with questions, some ideas. And then when you chat with people, you can start to have an idea of the answers, the next steps, etc. So I think from a practical point of view, I think that connecting with your peers and starting discussions is really important. Now, if you want to have a look at the position paper, basically the Canadian Pain Task Force had 6 major goals. And for each goal, we labeled ourselves as co-leaders or contributors. And so we make recommendations based on that, saying, hey, for example, if we think about enabling coordination, collaboration, and leadership across Canada, we think we have a really good relevance here and it'd be great to co-lead that. And we provide examples as to where exactly we can contribute. So for example, we could be providing a non-pharmacological and rehabilitation perspective to the discussion. So moving forward, what we've been doing and what's the next steps are is really trying to get the discussion going around this, having a sit at a table, putting a hand up and saying, hey, this is how we can help. And really trying to, as Krissy was mentioning, guiding almost the momentum that we have behind those policies. So I'm not saying this is the only way. We just say, here's another option. How can we make it work with you?
Yeah, and I can chat about how it started, and maybe Chris can talk about how it's really taken off. I was just kind of going through this. We created the position paper, and I'm like, wow, this is amazing. My job is done. But no, that wasn't it. We had wonderful people at CPA staff, and I really want to give a shout out to Kayla Scott and Lisa Carroll, who said, hey, we're going to start booking meetings with MPs and senators and other important people. And I'm like, what? I have never lobbied, never spoken to people like this before, but I'll just trust you on that. And they gave me a crash course on government relations and lobbying and all that. And Nathan was with part of this too. And so we met individual meetings rather, with 14 MPs. And at every meeting, there was always a balance of always making sure that there's someone from the CPA staff, like Kayla from the advocacy team, and someone from the volunteers, a physiotherapist, such as either myself or Nathan or all of us. And so we had 14 individual meetings with different MPs. We met with 2 senators. One of the senators actually invited us to come in person to Parliament Hill in Ottawa, which was really cool and special for me. And I got some fun pictures, but especially important conversations. And also got to meet with Health Canada's chronic pain policy team and got invited to give our viewpoint at the Canadian Drug Agency's transition office preparation meetings. And we presented also at the national pain rounds from the Canadian Pain Society. But in speaking to all these politicians, MPs, senators, and so forth, what really struck me was their reaction was not like this kind of reluctantly listening to us. It wasn't that at all. It was, where have you been? We've been waiting to hear from you. We're so excited to hear from you. And I'm like, wow, I guess it's not just me who's excited about this. And Krissy can maybe talk about where that took off from there.
Yeah, so that was our kind of first exploration in our current 2023 to 2025 strategic plan, which kind of guides the operations of the CPA and the objectives and goals of the CPA. It's written by our board. We're writing our next one right now. So look on the CPA website for how you can contribute to the strategic plan, or email me. My email is on there, and we'd love to hear from you about what you think we should be tackling next. But a big part of our strategic plan was advocacy. And because we had momentum around the pain file, both at the federal level and the divisions were really engaged in the working group, it was a good opportunity for us to create some relationships after several years of what I would call a slowdown or maybe hands-off approach to GR. We really started to ramp things up in that May 2023 period where National Physiotherapy Month was about paper. We were able to circulate the paper. We were also able to get a statement made in the House of Commons about the paper and the importance of physiotherapists and their role in non-pharmacological pain management. Since then, it's funny because people will say to me, oh, so the pain work is done. No, the pain work is not done. Every meeting we've had since, we provide resources to government leaders that demonstrate the roles that physiotherapists can have and show the importance of physiotherapy. And everyone gets the pain document because it really shows our ability to be agile, to respond to federal government initiatives. And it's a really wonderful example of what I would call is kind of an expanded message from the CPA around scope of practice and around health and human resource planning. So a big part of the dialogue with the federal government right now is focused on, we have a physician shortage and we have a nursing shortage and we have emergency rooms closing. And what is interdisciplinary care mean? And what do primary care teams look like? And so as we enter into those dialogues, we've now met with the Minister of Health, the Minister of Finance, the Prime Minister's office, several more senators, dozens more MPs, and all of those people who hear us talking about the value of physiotherapy and in leveraging physiotherapy to address health human resource needs, we use pain as an example because we have the evidence and recommendations of how pain and how physiotherapy can influence the system with policy and procedural changes. As Nathan said, we're asking for presence. We're being invited to tables and conversations that we haven't in the past. Just last month, I was at the Health Workforce Canada inaugural meeting, including an invite-only meeting in advance, where I got to stand up in front of a room that represented the health workforce modelers from every provincial government across the country and say, your health workforce algorithm only works if your inputs aren't only doctors and nurses, guys. If the input says that we have 10,000 people who need treatment for pain and your only output is this is how many doctors that takes, your algorithm is flawed. You need to have an output that says this is how many physiotherapists can help with that crisis. Unfortunately and fortunately, unfortunately, seemed quite revolutionary for some of them. We're like, yeah, maybe our algorithm is wrong. Maybe we're thinking about the math. Like, we're talking about true economics people and doctorates and who spend their entire time planning workflows for staffing in health and human resource, not really considering other professions as solutions to problems. The fortunate side of that is we were able to challenge that and follow up immediately with examples, evidence, support for the pain element of that. And now we've started to really build out our base of evidence that supports physiotherapists being in a variety of different roles. So I think that's an important piece of it is advocacy efforts have continued to balloon since early 2023. We've put a lot of focus, resource, and attention to advocacy at the association, and using pain as our first project has actually allowed it to become the cornerstone of how we talk about the expansion of utilization of physiotherapy, the importance of the role of physiotherapy, and the reduction in barriers to access at the policy level all the time. As we look ahead, it may seem counterintuitive, but I think the key pieces of our advocacy as we move into third-party payer advocacy are likely to be foundationally based in pain management. And the reason I say that is insurers are going through a very tumultuous landscape right now. Pharmacare and dental care are reducing the value of employer-paid benefits programs. And physiotherapy is covered as part of an employer-paid benefit program. The most expensive part of an employer-paid benefit program is long-term disability. And most people who are on long-term disability are in pain. And so for us to be able to go to a third-party payer and say, hey, you should really encourage employers to increase the amount of physiotherapy covered in their benefits package because it's going to reduce the number of people who end up on long-term disability, becomes a really neat new message that has come from 4 or 5 years ago, talking about what do we do in response to what the federal government has done. So this is a completely new audience to the CPA in terms of really starting to influence extended health benefits plans on behalf of private practice physiotherapy clinics and physiotherapists. And it's a really big focus for the association in 2025. And I can see an environment where the conversation about the reduction of people and costs of long-term disability is grounded in the idea that we can manage pain before they get to that.
So pain advocacy really served as a significant cornerstone to advocacy for the profession in general at the public level and third-party payer level. Oh, that's really interesting to put a perspective to that. It's not only about pain advocacy, but it's advocacy for physiotherapists.
For sure. I think one thing I would add to that, and one thing that I think really helped generate alignment early, is physiotherapists across all the specialty groups identified with the idea of treating pain. Whether 6 months postpartum, my pelvic floor physiotherapist is my absolute best friend, and there is nothing she does better than treat pain. Trust me, and whether it's my lower back or my upper back or any other part of my body, because I feel like everything hurts all the time. But she has become a really important part of my own pain management journey. Previous to being a postpartum mom, probably wouldn't have identified with. And I think that in the early stages was a part of why so many of the other divisions and specialty groups were really supportive of using pain as an initiative we could get behind together. But it's also a part of why it becomes such an easy way for us to continue to have a discussion about how we elevate physiotherapy, because I think a lot of consumers, and that is ultimately what government decision makers are, is they do consume physiotherapy as a treatment as well, go, oh yeah, my physiotherapist helped me, whether it was in injury or because they have chronic pain or any other ailment that has been treated, associates physiotherapists with that support. So it's become a cross-cutting part of how we advocate for the importance of the profession.
Yeah, well, I'm listening to Krissy talking about how these different areas need to be explored in terms of the value of physiotherapy, advocacy that talks about pain and beyond. And it made me think about the different areas where it's important to talk about all this work, where we're not just talking about reorganizing the healthcare system, we're not just talking about clinical care, but we're also talking about research, we're also talking about education. When you look at the Canadian Pain Task Force's recommendations and what we physiotherapists responded to in our position paper, we touched on all of these elements because when we're thinking about where we're advancing knowledge and research with the Canadian Institutes for Health Research and where they put funds for research grants, it's important that we're making advances in the areas of how to best provide rehabilitation, that we make advances in terms of how we best can help people in evidence-based ways that are non-pharmacological, but also making sure that when we're talking about the value of physiotherapists in the area of pain from a clinical or healthcare system level, that we're backing it up with a constant and unrelenting effort to raise the bar on our entry-level competencies and education in pain competencies for physiotherapists. And I think Nathan can provide some really cool insights around that.
Yeah, definitely. I was smiling there when you were saying that. My thesis basically is looking at improving how physio students learn to manage pain. And we know unfortunately that physiotherapy, like most healthcare professions, really don't get enough time and resources dedicated to pain management education. So we end up with clinicians that end practice and are not able to provide the highest quality of care to people living with pain. And we know, unfortunately, that this can result in poor outcomes for patients, in feeling stigmatized, in feeling dismissed. And we have a lot of research that says there are ways to develop the competencies related to pain management. Simple things like communication and empathetic demonstration are really, really useful and work really well in terms of pain management. So how about we invest the resources to make this a priority now so that it's clearly identified as a priority, so that now the funding agencies that fund research and the ones that look at university can dedicate more time to that. So it's always a battle of there are so many things to teach in physiotherapy and not enough time. But by making this a priority, we hope we can also influence other areas of physiotherapy. If you have someone that can speak well and demonstrate empathy, it's going to help everyone.
And correct me if I'm wrong, Nathan, but I believe physiotherapists in the area of research and education have been really leaders in terms of doing this type of initiative where we say, hey, let's look at what physiotherapy programs are teaching across Canada and universities for improving the quality of pain care that we provide and pain rehabilitation. And correct me if I'm wrong, but aren't we really leaders in that? And don't we have med schools and the OT schools and other health professions in the area of pain looking at it and be like, hey, we also need to do a standardization and raising the bar on our pain-related competencies curricula?
Yeah, I think that ties into a really good project we did, I would say 2 years ago now, where we got all the educators in physiotherapy and pain management in the country and get them together to discuss, including students, including educators, including people living with pain, what are the key competencies that physio students should be able to do. So we really got a national standard for pain management, saying this is what we want to achieve. This is what we want physio students to be able to do when they enter practice. And this has never been done before. Beforehand, there were other competencies that are really helpful, but it tend to be interdisciplinary, which is important. But when you look at the education of healthcare providers, they tend to be mostly done within the profession. So how about we start there and get together and decide what should be done? And this is what our research group here, led by Dr. Wyman, and we got together and created a competency profile. And since then, we've had discussions with people across the world at how can we move this forward. So some people in the US, for example, are looking great. Those competencies are really high level, really important, but what does it mean in actual practice? Let's look at some of those components. Some people are working on curriculum content related to these competencies. So it was a really important step.
It's good to put into perspective the ripple effects of the original pain advocacy into areas not only clinical care, but also research and more importantly, education. It's the education that is ultimately able to drive the quality of care we can provide and the effectiveness of chronic pain management. And of course, one of the goals of Paincast is to be a little part of that educating process. Just tying back to the position paper, we talked about how we can be co-leads and contributors or informers in different areas of the action plan. How are we currently being co-leads in certain areas, and how are we not being co-leads? There obviously has been great reception of that, as we're able to talk with many governors, MPs, senators, being invited to tables of conversations. What's the action step from this?
A couple of things. One, we heavily used the pain paper and the example of the role that physiotherapy plays in pain to successfully get Canadian student loan coverage expanded to include physiotherapists. So frequently we're asked, can you give examples of like the impact that physiotherapy could have, in this case, in particular in rural communities? And so we had at our fingertips quite a bit of evidence on the importance and the way that having more physiotherapists in rural communities to co-lead discussions and be contributors to those kind of conversations can change the outcomes for patients in a beneficial way. So it was a big part of that. I think another piece is I believe her title is Director of Health Workforce Information at High, is actually a physiotherapist. And so we started to be really involved in health workforce conversations. Like I mentioned previously, the conversation at Health Workforce Canada, we've been invited to several health human resource planning meetings being hosted on behalf of the government or with Health Canada or with the Canadian Medical Association, where there are recommendations being generated to the government on things like how we utilize clinicians, how we address primary care, all of those different things, the innovations that are happening, as both Nathan and Arthur said, and just a part of our recommendations in the actual clinical application of patient care. And so we have started to get invited to conversations we haven't been invited to before and started to play a role at the very onset of these discussions where innovation is starting to be considered nationally, be able to influence decision makers at that point to consider alternative treatment methods or alternative service providers other than the traditional methods that we have. So they seem like small impacts, but they actually become very significant when you know that the people that we're talking to or the people that we're influencing by getting invited to those meetings, having those conversations, the people that we're talking to in those conversations are the people who write policy at the provincial level. So I think that that's a really important step, is that CPA and physiotherapy are starting to have a lot more cachet, and we get invited to substantially more conversations that influence policy long term. That's harder to be. It's not tangible to say, hey, you went to that meeting, so now this policy was written in a way that's favorable to a physiotherapist. But unfortunately, advocacy traditionally is not quite as tangible. We love having something like student loan forgiveness where we can say, look, we influenced policy. But ultimately, it's about making sure that the stock in physio is really high so that as people are conceiving of things, they can't fathom an environment where they would create a system or a policy without considering the physiotherapist's perspective. And that is what we're really leaning into, and what the CPA in particular has a ton of momentum around generating net new opportunities with new audiences and new decision makers that allow for the elevation of the profession to the people who ultimately make important decisions. I'll also just add briefly, because I think it's worth saying, and Arthur, you're being bashful, and Nathan too, about their roles in lobbying. They were both wonderful. And I've both been in and seen meetings with physiotherapists, with government representatives. I think it's important to know it is a pillar of our advocacy strategy. We do not go into meetings with government officials without physiotherapists ever. So you would never see myself or Kayla, who's the Senior Director of Advocacy, or Lisa, who's our Senior Director of Professional Practice, go into a meeting with an MP or a senator where we weren't accompanied by a physiotherapist. I go to a lot of government meetings. I always have the best entourage because it's full of people who are knowledgeable and have hands-on experience. And I think that's a really important value for the Physiotherapy Association, is making sure that people like Arthur and Nathan speak to why physiotherapy is important and not me. And I get to just plug in the policy holes or be a person who can ask a hard question of an elected official and let them really interact with our members and the members of the profession who know it as well as both of these gentlemen do.
Something that I really want to underscore here is that I'm talking here because I started this group and I led this group up until last spring, and Nathan has taken over since. But it's a group of nearly 20 volunteers. I would have accomplished very little on my own. I would be remiss if I didn't take a moment to really underscore that it is a whole team of people behind my words. And it's not just the working group on pain advocacy. We spoke earlier about the work that's done on raising the bar on the university curricula with respect to pain competencies among physiotherapists. This was something that is separate to us, right? This was just a different group that had this initiative. When we start looking at provincial levels, there are so many other groups of physiotherapists who are also doing amazing work in terms of advocating for physiotherapy in the area of pain, but also in other areas and our scope of practice and really just to our overall value. And things are moving along really nicely. There's still so much more to get, but we're not going from zero. We are seeing an increasing trend of physiotherapists being more routinely invited, not just at the federal, but at the provincial level too, when there are tables that discuss how to implement new initiatives or how to change the healthcare system. When we look at family health teams or the groupes de médecine familiale, as we say in Quebec, we're seeing much more routinely the inclusion of physiotherapists. We have seen this before, but we're seeing it even more so. And so this is something that I think speaks to Krissy's point about the non-tangible expression of advocacy, where it just kind of echoes and resonates across the halls. And as different advocacy groups say similar things, it kind of helps to reinforce one another and creates, I'm going to be corny, creates a movement.
Thank you. For the last little bit of this interview, let's bring this conversation down to the individual physiotherapist level, or even people who are interested in pain or have lived experience with pain. First of all, I'm curious to hear this whole advocacy on pain and advocacy for the profession, led by passionate volunteers as members of the CPA, supported by the CPA. As a professional association, what does having a strong membership base mean for the power of a professional association?
Oh, I could talk about that for about an hour, but I'll keep my answer concise. So a couple of things. I think a big one is it's very important for us to have a robust membership base so that we can have diverse voices. The reason that the work was the quality that it was, the idea came from the place that it did, it took the shape that it took, was that it was a very diverse group of physiotherapists contributing to the efforts to at first figure out what we were going to do and then generate the momentum around our plan. And so I think a really broad understanding of the profession and an understanding of what issues are percolating and where the association can help is best fueled by many, many voices and more comprehensive of an understanding of the profession in all of its iterations. To Nathan's point, whether that's education, curriculum standards, understanding what's happening on the ground, understanding what your relationships are with payers, understanding how policies have affected you in ways that we don't even understand. I think diversity and volume of voices really helps the CPA understand where we need to put out fires or where we need to generate momentum or where we maybe need to let our own fire. So I think that that's a really big piece of it. The second one is that decision makers are influenced by volume. So to be able to say to a decision maker, whether that's a third party payer or a government decision maker at the provincial level for the branch or the national level for our association, being able to say that we represent the majority of physiotherapists in Canada becomes very powerful. And the bigger that number is, the better. Both because they look at things as votes if they're elected officials. I think that's a big part of it, but also because they look at the volume of people who touch voters. And so the catalyst or the unity of a profession becomes very important. We're quite unique in our structure. I can't say enough positive things about our relationship from a national body with our provincial branches and the partnerships that we have there, and then the partnerships we have with volunteers and the special interest groups. And a strong membership through all of those parties really strengthens our unity as a profession. We're seeing that with our advocacy around scope right now, where we're seeing jurisdictional movement happen because we can say, yeah, they do that in Alberta. Yeah, they do that in Nova Scotia, and we can prove it to you, and here's the evidence. Yeah, there is appetite for this in all of these different places. There is a national landscape for this. So the strength and diversity and rigor of the profession being behind the association enables us to speak with more authority when we are asking for decision makers to pay attention to an issue, and also put more rigor into ensuring that the issues that we tackle are the issues that impact the most people in the profession.
Yeah, that's very important. We talked a lot about pain advocacy at the national level, and you just briefly mentioned the importance of incorporating provincial advocacies in the advocacy of scope of practice. What about pain management? How is provincial advocacies able to contribute to that? Or how would individual provinces work on its own pain advocacy?
So we at CPA end up becoming a kind of lovely connection point between the branches often and the divisions. Not that they don't work together on their own, but that often becomes a role that we play. But one thing that National is very stringent about is our branches know all the time every advocacy issue that we're working on. Our pre-budget submissions get pre-consulted on at the provincial level. Scope is actually an initiative that was created by the branch presidents forum. So all of the branch presidents in the country sat together and said, oh, I'm having this issue with scope. I'm having this issue with scope. I'm having this issue. And it became clear that we needed our position statement on the scope of physiotherapy. So all of our advocacy materials, including the pain materials, are vetted and shared, and all our tools are shared with our branch partners. And often, if our branch partners experience an issue, or if I experience an issue, hey guys, I'm going to go manage a discussion around. Recently, I sat in front of the Senate on the importance of official languages in healthcare across Canada and access to a provider who can speak in your language of choice. We got that invite like 5 days before I sat in front of Senate, and we sent an email to every branch going, we're about to advocate on this. Like, hit us with everything that you've got, every tool that you've got. And similarly, they'll come to us and say, hey, my government just asked about pain. What do you guys have? And we'll say, these are the experts in the divisions that you can go talk to. They can come with you to meetings. You know, Arthur and Nathan aren't the only two pain experts now that we have who are advocacy trained who could go into a meeting, and also hear all our tools and our materials and our evidence and our research. So we have a really great two-way dialogue with the branch from the national office to go, these are the pieces that we're working on, or these are the things that we love you guys to help us fill in the gaps on. So I can't say enough positive things. I'm going to wax poetic about our volunteers. It's the life of the association, our membership, our volunteers, people coming into a meeting on their first meeting as the chair and saying, I think we should do something about this. That is really the fuel that gets the association moving. And our branches, in a very different way, become another really important piece of making and mobilizing those initiatives and those ideas. And that's through open communication and partnership.
Just to add to that, I think that's the direction we're aiming to move us towards in terms of the working group, where we've had people reaching out to us saying, hey, I've been doing that in this province. How can I move forward? So we have a meeting this week, actually. We're going to be discussing maybe a more structured approach to having, or local heroes, as we call them, kind of advocates for pain management at a provincial level.
So putting together two questions in one. What is something that only physiotherapists can do about pain advocacy moving forward? And how do we, at the individual level, who are passionate about bettering pain management in Canada, what can we do?
I think that physiotherapists have the unique expertise of being able to help people get to rehabilitation with a pain-informed approach. So we're thinking about movement and function specifically. I think we're really good and expert at this, helping people get back to living meaningful life from a physical movement perspective. We're really expert at that, and combining this with the pain understanding, we can really help people living with pain and regain a meaningful life.
I think what's really important when thinking about different professions across the healthcare spectrum who help people with pain is that, as passionate as we are about physiotherapy, it's not about us. It's about the person living with pain. If there is overlap between what some of us do and others do, then so be it. I mean, when you look at the statistics, it's 1 in 5 people in Canada that live with chronic pain, and this statistic has been growing towards 1 in 4. The burden of chronic pain has been estimated to be somewhere between $40 to $50 billion a year, which is more than cancer, heart disease, and HIV combined. So I think what I would really highlight is that physiotherapists are amazing team players that can really come together or help to bring together the different key players in helping someone with pain. And if you can get into an interdisciplinary team, that is absolutely the gold standard. But there are some accessibility challenges. And with a lot of physiotherapists also working in the private sector in addition to the public sector, we can become really key players in the community when it comes to not only helping from a rehabilitation perspective, because as we said, persistent pain is the #1 cause of disability, and we are rehabilitation professionals. We're also very valuable in terms of helping people make sense of their pain so that we're understanding pain within its broader nature, that it's not so scary as it once was. And I think a lot of physiotherapists can have stories where they find that when they were able to help patients achieve a better understanding of their pain as maybe a part of their body that's very natural and normal, but it's just being overprotective in a way. But then it kind of gets reconceptualized as, just because it's hurting doesn't mean that there's something really nefarious or harmful going on. It might be just that the pain is being disproportionate to the amount of damage that there is. And so it's actually safe to move in spite of it, and so on and so forth. And so getting moving again is another key thing that we do. But then this all kind of fits in a scope of talking about using non-pharmacological strategies and rehabilitation strategies, but also connecting that to the other experts, to the other very valuable parts of healthcare when it comes to pain care. And so I would say that we do have a lot of unique value to bring. And I think it's very important that we're invited at the table when there's discussions about it. I think it's also very important that we're part of the clinical team, the education teams, the research teams, so that we can provide our expertise and focus, but also to remember that it's not about us. It's about the person living with pain, and to make sure that we also welcome and collaborate with the perspective of surgical, invasive, pharmacological, psychological, and other also non-pharmacological and rehabilitation professionals.
Yeah. Go ahead, Krissy.
Yeah, I have nothing that could compare to Arthur or Nathan's response. I think from my perspective, as somebody who talks to physiotherapists every day, lean into why you became a physiotherapist at the beginning. Because from my experience, there are so many different types of physios, so many different natures of humans, whether they're in research, whether they're in private practice, whether they're working in an interdisciplinary team or a hospital or a long-term care center. There is this very altruistic, team and human-centered nature to a physiotherapist that you don't necessarily see when we're interacting with some of our interprofessional colleagues, and with no knock at any of them, but that the human focus, the patient focus, and the unbridled passion I just have never experienced. I've worked in associations most of my life. The passion for ensuring that your patient is doing well, or ensuring that the curriculum is set up in a way that equips other physiotherapists, or ensuring that research reflects the latest innovations. I think embracing the passion that you have, that can be literally in how you talk to your patient. It can be literally in, as Arthur said, how you talk to your colleagues. It could be how you become a volunteer at the CPA. Really embracing why and who you are as a physiotherapist. It makes my job really easy, because then I get to tell everyone how great you guys are.
That's really sweet, Krissy. Now, we talked from high level down to the individual level, back to the high level vision of the future of pain management in Canada. Any thoughts on that?
I'd like to see a world where physiotherapy is as accessible as pain medication or pain management, where someone comes in, they might not see a doctor first, they might even see a physio first, but let's not be too hopeful. And let's say they go through, see a doctor, and physio is one of those options that are available as easily, as cheaply, as readily available as another pain medication.
Hear, hear.
Mm-hmm.
I think we should just kind of stick with Nathan's words. Those were pretty good.
Awesome. Awesome. Okay, so for anyone who listened to this podcast and was some inspired and super passionate, how would our audience get in touch if they're interested in participating in this or supporting the efforts of CPA or the working group?
The easiest option is to join the pain science division. Again, I'm not paid by recruitment, but I think it's a really great resource. And I say that from a personal experience, where initially I joined as someone interested in learning more about pain management. Then I got involved. I became the lead of the newsletter, and then I'm leading the working group. So it's really, the first step is just attend maybe a meeting, see what they're organizing, see if it interests you, and get involved. I think that's really the easiest way. And I think Krissy was mentioning, our email is over there. So if you're interested and have an idea, send us an email. We'll be happy to take it from there.
For the association, it's the same. If you're hesitate for whatever reason, and I can't think of a good one to get in touch with the pain science division, then you can always reach out to me or to the CPA through our information at physiotherapy.ca inbox. If you have ideas, if you're not a CPA member yet, so you can't become a pain science division member, and you want to talk about why that's the case, I talk to members every single day. It is the beautiful part of going from chief marketing and membership officer to CEO is you get really used to talking to the members before you take the top dog job. So I really welcome feedback, conversation, and anybody who has questions or concerns or thoughts about anything, you can always reach out to me. And I might pass you to somebody who knows something more than I do, because I definitely don't pretend to know everything about everything, but we really love member engagement. And so encourage you to physiotherapy.ca page has how you can get a hold of me or how you can get a hold of the CPA.
And remember, it's okay if you've never done lobbying, never done advocacy, no matter how many years or how few years you have under your belt, none of that matters because you can accomplish something really great by just saying, I think we should do something about it. And then have a whole team of people just rally their way around you and support you and work together.
Yeah, that's great. We're such a group of passionate individuals here. It's currently 9:40 p.m. But any concluding thoughts? I don't want to miss anything before we stop.
I would be remiss if I didn't take an opportunity to say thank you to Arthur, to Nathan, to everybody who is on the working group in the past and in the future. I've been on the emails about the meetings that they've got set up coming up soon. And also to important staff. We mentioned both Kayla and Lisa, who were really critical in orchestrating things from our end. So I am honored every day I get to work with passionate people and help them realize their passion or put them in front of somebody they never thought they'd talk to. So I just can't say enough about Arthur, Nathan, the pain science division, and all the divisions and volunteers who contributed to this effort, because our ongoing success and momentum really was generated from the spark of an idea that happened at a meeting. So thank you to everyone, all of our members who have embraced our strategic plan around advocacy and let us generate some momentum from that.
And for me, I want to say that there's hope, but we need help. I think there are a lot of really exciting initiatives, whether it's in research, education, pain management, and practice. And there's hope out there for people who are suffering from chronic pain, or the clinicians that are not sure what to do, or the students who would like to get better. There are resources. Get involved, and it will move along faster.
And I would just highlight again what so many MPs and senators and other people in leadership positions said. Where have you been? We've been waiting to hear from you. And most often than not, no matter who you speak to, no matter what position they're in, we sometimes are maybe a little bit intimidated at times to engage, but so often we're met with open arms and just this willingness to work together. And so don't worry about how things are received. Trust your gut. You see a wave, try to catch it, say that you need to do something about it. And it's probably going to be received with open arms within your team, but also on the receiving end, regardless if they're a minister, senator, or otherwise.
Thank you so much for all of your time and passion and effort all through the years.
Thanks, Tiffany.
Thank you, Tiffany. Thank you, Paincast.
Thank you for listening to this episode on pain advocacy. If you want to read more on this topic, We've included articles and links in the show notes. Paincast is a freely available resource for you to advance your knowledge about pain and physiotherapy. We will continue to provide you with top-notch, evidence-based, and practically oriented content. To help more people know about this amazing resource, follow us, give us a rating, and share about us with your network. Follow us on Instagram at paincast.psd, where you'll find bite-sized knowledge in 1 to 2 minutes. You can also use the feedback form linked in the show notes to help us improve. Thank you again, and stay tuned for future episodes on pain and physiotherapy.